Good morning, good afternoon, and good evening to everyone. I'm thrilled to be here at the Economist Innovation at Work event. I appreciate that the Economist is taking the lead on important topics that we're all tackling together, such as technology transformation, the importance of engaging talent, and the future of well-being. It's a real pleasure to be here with all of you today. I am Stephan Scholl, CEO of Alight Solutions. And I want to start with a question to the leaders, managers, and executives with us today. How many employees in your company can come up with $500 in a moment of crisis? Just think about that for a minute. To be honest, in my past leadership roles, I didn't know the answer. And I also didn't fully appreciate why it's such an important question to be able to answer. It wasn't until I joined Alight and started speaking with more of my peers and saw the challenges our employees were having in the face of the pandemic that the urgency of this question was clear to me. I was surprised to learn about this and committed to helping raise awareness. At Alight, we have the privilege of working with 70% of the Fortune 100 and over half of the Fortune 500. So I've spent a lot of time with CEOs, CHROs, and leadership teams. And we're all talking about the issues straight out of the headlines, the Great Resignation. And we're all realizing more and more that there is a very important link between belonging and loyalty and overall well-being. This is a critical connection that we as leaders have a responsibility to embrace. So let's think about this. If overall well-being can lead to a sense of belonging and loyalty, it's critical to understand all of the components of well-being, how they are connected, and the role we as leaders must take on. We have a responsibility to set our people up for success when it comes to their physical health, their mental health, and their financial well-being. That's why asking ourselves the right questions in service of our employees has never been more important than right now. We need to ask the questions so that we can better understand the enablers and barriers to our employees' health, wealth, and overall well-being. We all know the relationship between mental, physical, and financial health is really interwoven. When one is off, all other areas are impacted. Depression increases the risk for many types of physical health problems, including chronic conditions like diabetes, heart disease, and stroke. And by the same token, the presence of chronic conditions can increase the risk for mental illness. To make matters more troubling, individuals with depression and anxiety are 3 times more likely to be in debt. And we know that's both a cause and effect. Asking the right questions and being able to answer them can help leaders approach some of their biggest workforce and business challenges in a different, data-driven way. And it can completely transform your ability to build a more meaningful relationship with your employees, to build belonging, keep them longer, and help attract future employees. As leaders, we all understand the importance of focusing on improving the experience our customers and clients have. We understand the need to drive shareholder value. These things are table stakes today. But shouldn't we all agree taking care of our people should be viewed just as critical? I believe we are in a new era, the era of the employee, where companies will be judged on the way they treat their people. And this isn't just coming from me. Employees are demanding this. The key to a strong share price, to growth, to new clients and loyal customers is our employees. They always have been, but corporate leaders are feeling it even more. And belonging and loyalty is more important than ever. You know, a number that recently caught my eye was 55%. That's the percentage of American adults who say they are planning to switch jobs in the next year. I mean, think about that, 55%. Millennial and Gen Z employees, who now account for more than half the workforce, are even more likely to be searching for something more. There isn't a one-size-fits-all explanation for this flight of talent. In fact, one-size approaches are part of the problem. But a lot of it comes down to the fact that employees want a sense of belonging and to be recognized as contributing to the bigger picture. It has been proven that people cannot have a sense of belonging if their basic needs are not met. Basic needs such as physical and mental health and financial security. The leaders and companies who recognize this, who act on it now, will have a serious competitive advantage. That's why I'm so excited to be sharing these stories with all of you here today. If we go back to April 2020 when I started, on a Saturday morning early in the pandemic, a UPS truck pulled up outside my house and the driver handed me a box. Inside was a laptop, a t-shirt, a hat, and a note that said, "Welcome to Alight." That was my first day on the job. 2 days later, I met my colleagues and management team virtually, just like we're talking right now. That Monday, the front page of the New York Times ran a story about how Elmo was starting to social distance on Sesame Street. Another story said that the NFL draft picks were going to be announced that night from the commissioner's basement. To say the least, things were interesting. It was certainly an interesting time to join any company, and it was especially an interesting time to be joining this one. For those of you who don't know Alight and what we do, we're a cloud-based provider of human capital solutions. Essentially, we work with employers to ensure that every employee has confidence in the two most impactful areas of their lives, their health and financial well-being. We do that by bringing together all of your human resource programs into a singular, easy-to-use platform. This way, employees have access to all the programs a company offers, along with data-driven personal recommendations so that they can decide what programs are best for them and for their families. When I started this job a year and a half ago, as a longtime tech executive, I assumed I would be playing the role that a CEO typically plays, establishing a vision for the future and devising a strategy to make that future a reality. As I started talking with other CEOs and especially CHROs, I quickly learned that my focus needed to be bigger, frankly, much bigger. CEOs, CHROs, and leaders have a higher calling, fiercely contributing to the well-being of workers by creating an engaging benefits experience that helps them make better decisions about the health, the finances, and future plans for themselves and their families. And today, that can be a complicated problem to solve. I spend most of my time thinking about the role companies play or should play in their employees' lives and what support companies should provide to ensure they can retain a strong and healthy workforce. The pandemic has, and rightly so, put mental and physical health front and center for all of us. Take mental health. The number of Americans experiencing anxiety and depression is way up. Last year, 42% of U.S. adults reported mental health-related symptoms, which is up 11% from previous years. The pandemic has also shown us how important and sometimes fleeting financial well-being is. The way we work and our relationship to our jobs has transformed dramatically over the last 17 months. It is forcing people to reevaluate their priorities as remote working opens up new job opportunities they never had before. And let's be honest, employees also faced very different obstacles than they have in the past. When I went to visit one of our customer care centers, there was a mother that felt she had no other option than to bring her young children to work with her. Schools were closed, and she didn't understand or have access to the right information to help her with that issue. She needed to work. She needed to help keep her kids safe. I sat down with her to understand what kind of system she needed to balance work and life, and worked with my leaders to make sure we took the responsibility to help her understand all of our options better. And that's just it. The Great Resignation stems from a much deeper sense of dissonance than simple unhappiness over pay or benefits. It stems from a sense that it's no longer okay for a job to come at the expense of your health, your posture, your relationship with your spouse and children, and your sense of purpose. If your current job doesn't respect or honor what you value most, you will find a job that does. The competition for talent has been called a war for pretty much my entire career, but this time really does feel different, and the data backs that up. The pandemic has accelerated a tightening of the labor market. Every day, as I mentioned previously, every day there is a new story about worker shortages and employee departures. In the UK and the US, these shortages have closed gas stations, shut down entire sections of hotels, and left ships sitting unloaded at ports because they're scrambling for dock workers. Chambers of Commerce in the US say worker shortages are holding back economic growth. Unfortunately, it's likely these shortages will far outlast the pandemic. Korn Ferry, estimates that by 2030, there'll be a global human talent shortage of over 85 million people. That's just 8 years away. As I noted earlier, the leaders in companies who recognize the need to change how they engage with their employees and act on it will have a serious advantage over competitors. I said that because I believe that the winners in this competition for talent will be the companies that innovate in how they treat their employees. Now, to be clear, the innovation I'm talking about isn't installing ping pong tables or offering free lunches. Innovation here is meaningful, sustained change powered by two things. The first, unsurprisingly, is technology. But the more important element is the second piece, the commitment from leadership to use technology in a way that improves the health, the wealth, and wellness of their employees. We should look to other industries for inspiration. Consider Nike, one of the great consumer businesses in the world, and how it uses technology to engage its customers. I have twin 12-year-old daughters. One of them went on Nike's website not long ago and ordered a pair of shoes. The left one's green, the right one's blue, and they have different laces. From start to finish, it took her only a few minutes. Now, this clearly isn't as complex as physical and mental health and financial security, but let's think about the experience we are giving employees in these critical areas. How simple was it to understand it, let alone enroll in it? What about your retirement plan? The average large employer offers almost 50 different touch points for their health, wellness programs, and insurance products in the United States. Even more options if you look at the programs these companies offer globally. If we don't need to go to 50 places to complete an order for customized shoes, then why must we do that for healthcare and financial services and savings? Why, if you have 50,000 people, can't you have 50,000 programs that are tailored to each person's needs and have it all in one place? Seriously, why not? The good news is that the technology is there already, and it's getting even better. What's most needed now is that commitment from senior leadership. That's where we come in. What's interesting is that a lot of leaders tell them they want to change their relationship with their employees. They know they need to, but they are also under a cost crunch. And they view the situation as either or, saving money or offering better benefits to employees. We are working every day to turn this or into an and. First, as many businesses can attest, they're already spending a lot of money on benefits. After salaries, benefits are typically the second biggest cost for a company, and they increase between 6 and 20% every single year. The problem is that this investment is unfocused and isn't delivering great results. Adding more programs will not fix the employee experience. 60% of Americans can't retire when they want. Simplifying interactions and engaging employees with personalized guidance will drive different results. Meanwhile, half of the employees in the United States regretted a healthcare decision. Just think about that, half. There is so much more we can do to help our people. Part of the reason is that companies have shifted more responsibility to employees when it comes down to benefits, and they haven't given them the tools or support to understand or navigate that new responsibility. In the United States, we have tools to build retirement and health savings programs, such as 401k and health savings accounts. They are hugely important and often quite complex. And while employers feel they're doing the right thing by investing in them, employees often feel overwhelmed, confused, more than grateful and supported. This makes them less likely to use the benefits offered to them. I'll give you a great example. One of the largest employers in the United States, on average, spends $3 billion on healthcare annually. Yet only 7% of the employees who made $40,000 and below had the right critical care and illness coverage. The most financially vulnerable employees had a weak healthcare safety net. So how did this happen? Well, the company had introduced 22 new programs, but only 2 were applicable to people earning $40,000 or less. And instead of highlighting certain programs to the relevant employees, they simply rolled out all 22 programs together to everyone. And so most of those people earning $40,000 and below did what a lot of us would have done. After a while, they threw up their arms and said, I don't know. Here you have the company spending billions of dollars and thinking they're doing the right thing, all to have 93% of their lower earning employees lacking the critical care coverage they need and that are offered. By the way, at the same company, more than 90% of the employees earning more than $92,000 a year had the right critical illness care. That's because most of the programs were geared towards that income bracket. So there's a really important equity component at play as well. And that is a critical lesson the data brings to bear. Companies are inadvertently reinforcing equity issues in how they present their benefits to their employees. Another way to think about this is how many of your people elected a high deductible plan but can't actually afford to use that plan. There's an opportunity to start solving for enterprise diversity, equity, and inclusion shortcomings by being more thoughtful and intentional in how companies educate their employees about their benefits. Leaders should be committed to implementing truly tailored programs because their teams, their businesses, their communities will benefit. I truly believe that we as leaders have a great opportunity right now to start solving these issues for our people. You know, the good news is that leaders are increasingly appreciating the importance of supporting the employee. That's why large companies are consolidating the once siloed decision points between payroll, wealth, health, and benefits. I hear all the time, I need a better view of my employee across all those continuums. You know, I can relate. I've served in leadership roles across a range of companies and also as a member of company boards. And I feel like it's firmly and rightly now a board-level conversation. Benefits used to be an afterthought and sort of in the corner. Now they're front and center. I'm hearing questions being asked that I've never heard asked before. So that brings me to the how-to portion of our discussion. As leaders, how can we take steps to improve our focus on our employees in meaningful ways? In ways that contribute to their overall well-being, leading to better belonging and ultimately increased loyalty. I say, let's start by being committed to their overall well-being and seeking to understand the answers to questions like, how many of my employees can stitch together $500 in a moment of crisis? How many of my employees are engaging with their benefits programs in a way that is actually benefiting them? How many employees have put off routine healthcare procedures over the past year? And finally, how many employees in my company are battling depression or other forms of mental illness? The answers to these questions exist, whether or not you know them. By searching out the answers, becoming aware of them, and by acting on them, you can do more than avoid a crisis in your workforce. You can initiate tremendous change, tremendous growth, tremendous benefits for your employees, your business, our communities, and the global economy. Thank you for your time today. I can't wait to see your comments in the chat to learn more about the ways you are putting well-being at the center of your employee experience.